Hey guys, it's Jenny on the block, and I am excited to be here today. I'm here with Dr. Johnathan Buggey, and he is a cardiologist from Summa Health. So welcome, Dr. Buggey.
Thank you. Thanks for having me.
Yeah, of course. Thanks for being here. So cardiology is the study of the heart. Is that correct?
Yep, absolutely.
All right. So today we're talking a little bit about pulmonary hypertension. And I'm gonna be honest with you, I've heard a lot of things about the heart. I don't 100% know what that is. So can you tell me what it is?
No, absolutely. And you wouldn't be the only one. And so it's typically a condition too that is treated by both cardiologists and pulmonologists. Usually the cardiologist or just somebody who has an interest in specific training, or somebody like myself who is specifically trained with heart failure and advanced heart failure patients. Pulmonary hypertension itself, by the simplest definition, is just high pressures in the lungs. But defining it beyond that becomes a little more complicated. There's 5 different subtypes that the World Health Organization recognizes, the WHO. And when we think about the different subtypes and what is actually causing the high pressures in the lungs, it can vary a little bit from type to type.
Okay. So I guess I didn't realize that we're talking about the lungs when we say pulmonary. That's that part.
Yep, absolutely. Yeah. So pulmonary meaning the lungs, and then hyper meaning high, and tension is pressure. So high pressures in the lungs.
Interesting. Okay. So tell me the difference. And this is very interesting because I have had high blood pressure in the past. So what's the difference between pulmonary hypertension and high blood pressure?
Yeah, so high blood pressure, or what's often referred to as just hypertension, is referring to arterial blood pressure, and that is usually measured in the office with a routine blood pressure cuff, or some people do it at home, the pharmacies, etc. So commonly referred to as just hypertension, completely different disease process than what we're talking about here today. Although certainly people can have both, they in and of themselves are completely separate and require separate treatment strategies.
Oh, okay. Okay. So as far as signs and symptoms of pulmonary hypertension, what are some of those signs and symptoms that people can be looking for?
Yeah, the most common is just going to be shortness of breath. Somebody's going to say that they're having more exercise intolerance, they're getting winded faster, and as it progresses, they could even be short of breath at rest. As the high pressures start to really affect the heart, which is part of the reason cardiologists get involved in this disease process, we can have a lot of other problems arise. Fluid retention, which can show up like swelling in the legs and the feet, or bloating in the belly. And people can even experience just a passing out episode, and that could be the first sign that something's wrong. And again, when things progress a lot, we can even have low oxygen levels, or what we refer to as hypoxia.
Oh, okay. All right. So the heart is involved, which is why you get involved, which is interesting.
Absolutely.
Okay.
Yeah, so I mean, anytime I have patients come in to see me and we're talking about shortness of breath, and particularly, we really have to focus on both. I mean, the heart and the lungs are intricately connected. The right side of the heart pushes all the blood into the lungs. The left side of the heart gets all the blood back out of the lungs and pushes it to the body. So whenever one is dysfunctional, it inevitably affects the other one.
Interesting. I guess I never knew that, which is like an insane thing to say out loud, but I never knew that they were that intertwined, which I mean, it's great. So treatment options for pulmonary hypertension. Obviously, it sounds like something you should, probably get fixed. So what are the options?
Yeah, so they vary, first starting by what type of pulmonary hypertension you have. And that kind of goes back to the first thing we were mentioning. There are these different subtypes that are defined very specifically. And that's step one in terms of that process. But as we think about the different treatment options, sometimes that's going to focus just on treating the underlying cause, which might be something as simple as COPD, emphysema, congestive heart failure, heart valve issues, and that can help relieve the pressures in the lungs. But if if it is a specific kind of pulmonary hypertension, we sometimes need to take very specific medications. They can be in pill form. They can even be inhaled form, intravenous, and that can be delivered into the veins via a pump and a catheter, or even a catheter in the subcutaneous tissue. So just kind of underneath the skin in the belly typically. And in some circumstances, we have to even progress to thinking about more advanced procedures, surgeries, or even lung transplantation for some people.
Wow. Wow. Okay. So this can get pretty serious, but it sounds like it could be managed. Is that kind of a correct statement?
Absolutely. There are absolutely good management strategies out there as long as it is being accurately diagnosed and followed up and monitored over time.
And then as far as Summa is concerned, what are you guys doing to help patients with this condition? Because I know you guys are kind of on the first frontier. You always have something good going on. So tell me what Summa is
Yeah,
doing.
we definitely want to be, for sure. No, and it really starts with accurate diagnosis. And there's a lot of things that go into this, as we were just discussing. I mean, we haven't really even gotten into the weeds on how complex that is. So it requires somebody who has knowledge about the different types. And then there's a whole slew of testing, to be quite frank. That includes lab tests, X-rays, CAT scans, pulmonary function tests, echocardiograms, and ultimately our kind of gold standard, as we say, for diagnosing is a heart catheterization, where we physically go into the heart and lungs and we measure the pressures directly.
Wow.
So first, making that correct diagnosis, and that's absolutely something we have the capability of doing here at Summa. It's something I do personally as well. And then once we have that diagnosis, we figure out what treatment plan is going to be best for each individual patient. And if that involves these very specific medications, they can be hard to understand. They can sometimes be hard to obtain. We have wonderful specialty pharmacy here at Summa that helps us with that. And then they require proper monitoring, both of the medication, the side effects, as well as the progression. Because of course, if somebody's not responding to first-line therapy, you need to move to second, third, and so on and so forth.
Right.
So we do have a multidisciplinary clinic specifically designed for this as well. So we call our, quite simply, pulmonary hypertension clinic. And it utilizes myself and my colleague, who are cardiologists, pulmonologists, pharmacists, as mentioned, and we work together to really make hopefully the patient care experience much better.
Yeah, I feel like you guys do a great job with the team approach, because the body, like I just discovered, is a very intertwined thing. So it's not always just the lungs are separate from the heart. So
Yeah,
super interesting stuff. Yeah.
Absolutely, yeah.
Well, thank you for being here. If you guys have any questions or you want to get more information, you can go to summahealth.org/lung, or you can call 877-515-4518. And I want to thank you again, Dr. Buggey, for being here. And this is, again, it's been very educational for me, I'm sure for everyone else.
No, thank you, Jenny. Thanks for having me.